Hello everyone. Welcome to my YouTube channel. My name is Anjogu, and today we are going to discuss our lecture 2 about physiological changes in pregnancy, and our topic for discussion is cardiovascular changes. What are the cardiovascular changes in pregnancy? The physical demands of pregnancy, which are increased metabolic demands of the mother and fetus, require body changes, which are increased cardiovascular output, heart rate and blood volume, and reductions in blood pressure and systematic vascular resistance. Inadequate changes in cardiovascular in pregnancy can result in maternal and fetal morbidity, as seen in preeclampsia and intrauterine growth retardation. The two conditions, we are going to discuss them in our future lessons. What are the normal changes of cardiovasculars in pregnancy? One is cardiac output. What is cardiac output? Cardiac output is amount of blood heart injects per heartbeat. And cardiac output is abbreviated as CO, is equals to stroke volume times heart rate. What is stroke volume? Stroke volume is the amount of blood pumped out of the left ventricle of the heart during each systolic cardiac contraction. So during pregnancy, due to increased metabolic demands of the mother and the fetus, the cardiac output increases throughout pregnancy and tend to increase to about 30 to 40%, which reaches its peak between 20 and 24 weeks of pregnancy in a singleton pregnancy. In case of a twin pregnancy, the cardiac output increases by 15% more than the singleton pregnancy. There's a debate as to whether the cardiac output increases, decreases, or plateaus during the second and third trimester. Let's talk about the heart rate. The heart rate increases throughout pregnancy, with most prominent increase of 15 to 25% in the third trimester. This can be translated as a woman having 80 to 90 beats per minute compared to an unpregnant woman with 60 to 70 beats per minute. The second change of cardiovascular changes is blood pressure, which typically decreases in the first trimester for about 10%, and second trimester goes down to 5%, with a slight increase in the third trimester with 5%. The third cardiovascular changes in pregnancy is vascular resistance, which typically decrease to about 30% compared to an unpregnant state until the second trimester. This results from systematic vasodilation. Systematic vasodilation in pregnancy is very important because it shunts blood toward essential organs such as lungs, heart, kidney, and placenta. As we know that increased blood in the placenta increases the supply in blood for the fetus and other nutrients. And another example is increased vasodilation in the kidney result in 50% increase in renal plasma flow, which increases glomerular filtration rate, which reduces serum creatinine, urea, and uric acid values in the blood. The third change is plasma volume and red blood cells. There's a significant increase in total blood volume to about 45% and plasma volume to about 40%, and red blood cells during pregnancy. The plasma volume increases proportionally more than RBS cell mass, resulting to a physiological anemia. A HB of 11 gram per deciliter in pregnancy is considered normal. By the 6 weeks postpartum, cardiovascular, heart rates, vascular resistance, plasma volume, and red blood cell mass return to a normal state. Cardiovascular changes during pregnancy are characterized by an increased vascular volume, cardiac output, and heart rate, with a marked fall in vascular resistance. In summary, we can say pregnancy is a high volume and low resistance state. The next mini lesson, we are going to discuss about pulmonary changes in pregnancy. Thank you for watching and see you in the next one.